Take it away.
Excellent. Well, I am so delighted to be with you all today. Um, I have been in health and human services nonprofit work for about 38 years, and I've been at Faith Family Medical Center for 3 years, working on HealthPass primarily. And it's been a great delight to work with small businesses and small nonprofits to offer an alternative when there isn't a option, a viable option often for small businesses to offer at least some sort of healthcare benefit. So it's just wonderful to be able to be that solution for small businesses. And often I hear, this is just too good to be true. And I'm like, no, it's true. It's true. So I'm delighted to share that. Um, I'm going to tell you a little bit about Faith Family Medical Center. Let me move this as it is blocking. There we go. So Faith Family Medical Center is HealthPass is the social enterprise for Faith Family Medical Center. Therefore, I'd like to give you a little information about Faith Family Medical Center. We are a nonprofit. We began in 2001. That's 23 years that we've been providing primary care in Middle Tennessee. We serve people who work but don't have insurance. We also serve people who are underinsured. We started that with the Affordable Health Care Act when that began, but primarily we serve people who work but do not have insurance. We treat the whole person. We provide, of course, the physical needs, mental, and we'll talk a little bit about the behavioral health component that we have, emotional support, spiritual support, and healing. We base our model, we're not an urgent care facility, and I'm telling you all of this because when we get to the products for HealthPass, you will know where your employees would be coming if you all choose to participate. So we offer nutrition, fitness, spiritual counseling for those who want. It's all on an affordable sliding scale copay based on income and number of dependents. So we know at Faith Family Medical Center, since many of our employees do come from small employers, we know that small businesses and nonprofits want to provide enticing, robust healthcare to their employees, but it needs to be affordable and accessible and high quality. So we know also that health care coverage can be confusing in addition to expensive, and figuring out how to access it can be hard to do. But there's good news. Giving your employees access to the health care they deserve just got easier through HealthPass. We provide this low-cost membership-based solution to enable employers like you to offer these healthcare solutions. So let me tell you more about that option of HealthPass. So again, we know and you know that it is often a requirement to recruit high-quality employment or employees, but it's expensive, and employees sometimes be intimidated by the healthcare system. So HealthPass is significantly more affordable for the employers and employees if you choose to pass on some of the cost to your employees if you join us. We are about 10% of what it would normally cost to allow your employees to access primary care. Through benefit study through the Kaiser Family Foundation, that's how we've come up with that information. The cost of individual insurance premiums, the national average, is about $702 per month. And they just released, the Kaiser Foundation just released the 2024 employee benefit study, and naturally, it's gone up since then. So we know that healthcare is expensive. We know insurance is expensive. We do have, as I said, that 23-year dependability and trust and reliability that through Faith Family Medical Center. And we can access not only for English-speaking employees, but we have Spanish-speaking clinicians, front office staff, etc. So that's important for many small businesses that rely on a non-English speaking employee base. And it's not just Spanish employees that we can help, but in most any language can we help employees that are non-English speaking. So HealthPass does solve the health benefits solution, particularly if you are moving toward a very comprehensive, it's a good step toward a very comprehensive insurance, or HealthPass may be what you are able to afford. HealthPass is definitely a win-win-win. It's a win for the employers, a win for the employees because they can receive affordable, high quality, and accessible primary care. And of course, employees have a healthier life and can work harder and less absenteeism. So I recently heard a testimonial from one of our HealthPass members, also known as an employee. She works at a daycare, and prior to coming, and this is a story we hear frequently, prior to coming to Faith Family, she couldn't afford to go anywhere else. And when she finally came to us, we found that she had not only hypertension, but she was diabetic. And that is often the case. Many people have not been able to afford health care at all. And by the time they come to us, we have to help them rein in some of the existing chronic conditions. So that testimonial from that employee was, they helped me get my hypertension reined in, certainly managing diabetes, so that she can live not only a healthier life now, but catching those chronic diseases further upstream. But it's not just the dramatic that we serve. It's also people who just want to have a basic physical exam to see where they are in their healthcare journey and what they need to do to be healthier, not only now, but in the future. So we designed, as I said, HealthPass for the small employers. We are centrally located. If you know where, well, for those of you who've been around at Nashville for a while, it was called Baptist Hospital, but it's now called St. Thomas Midtown Hospital. We are, I will say, kind of in their backyard, if you will. Centennial Hospital is one side. We're near Charlotte Avenue. So we're centrally located in that healthcare arena where Centennial, Vanderbilt is near us, and St. Thomas are located. But easily, we're near downtown, but we're not in downtown, so much more easily accessible. And we have our own parking lot. Never underestimate how important that is, right? So that's important. We can serve people from anywhere. Now, naturally, someone would want to come from Arizona to Faith Family in Nashville to get their services, but that's important for you to know. There are no places that we cannot serve. So we served, of course, typically Middle Tennessee, which of course Davidson, contiguous county, Cheatham, or so that's where we serve. Let's start talking about the types of plans that are available. But before I do, does anybody have any questions about Faith Family Medical Center and how we've gotten to this point of offering HealthPass? All right. Well, so let's get down to the nitty gritty of, okay, Anne, what do you all offer through HealthPass? We have 3 products. As you hear about them, know that you can offer just one of them. You can offer 2 of them, 3 of them. You can tailor HealthPass according to your needs. And the flexibility and the ability to do that is very important. So it's highly customizable, flexible. There's easily, you are not committed to a year, for example, of being a part of HealthPass. You can get out of HealthPass at any time, you as an employer or employees. So that's important. Now, I'll say most don't. We have 25 business partners, and we've retained everyone that we've signed on since we began 3 years ago. That's a great track record. But that is often a challenge or an objective. So want to make sure you know that it's very flexible and you're not locked in. HealthPass Primary. Let's talk about that first. HealthPass Primary is $38 per participating employee or member per month. And that's important for you to hear, per participating employee, because again, you do not have to have all of your employees participate. It could just be one, and that's fine. Or if you're just a solo entrepreneur right now and you want this just for you, that's fine too. I have a couple of partners that fall in that category. HealthPass Primary, $38 a month per employee or per member. So you will see on this slide what is included. These are all provided through Faith Family Medical Center. Talked a little bit about the primary care. Behavioral health, also known as mental health. That is included in this primary care package. And that we have a psychiatric nurse practitioner who can diagnose mental or behavioral health needs, prescribe medication, follow along with the patient, and we are not pill pushers. So there are other ways that we can help patients with their behavioral or mental health. But that's important, and there are not very many primary health places that have a full-time behavioral health nurse practitioner, and she does some counseling. We provide women's health, and that's as you can imagine, very popular. We have volunteer specialists who are on site. For example, we just had a physical therapist who is giving her time to our patients here at Faith Family Medical Center. So that is one example of a specialist. We also have 2 gynecologists, we have a cardiologist, we have an orthopedic surgeon, and the list goes on. And those primary care physicians come here and see our patients on the sliding scale of what we charge our patients. We have chronic disease days, which you heard me mention, hypertension and diabetes. Those are unfortunately 2 of the most prevalent diseases that we encounter or that are encountered. And one time per month, we have our patients who would like to participate that have one of those chronic diseases come in free of charge and see, for example, a provider for 15 minutes, check out their pharmacy or their meds. They have their feet checked, their eyes checked, et cetera, and that is one time per month for our patients who have one of those chronic diseases that want to participate. We have registered dietitians, and our patients see the registered dietitians, if they choose to, free of charge, as many times as needed. I mean, that's huge, and this is all part of HealthPass Primary. We have pharmacy assistants for patients who qualify. Last year, we were able to give away $3.4 million worth of free medications to our patients. So again, for the employees who participate in HealthPass Primary, they would be able to see if they can get their free medications too. Of course, we refer out for specialist or diagnostic testing. Uninsured patients can go to our network of 150 partners that we have with whom we've created relationships. They know that our patients are self-pay because they don't have insurance, and the prices that they charge our patients are significantly lower, of course, than what they would be paying normally if they had insurance. And then I've alluded to the Journey to Wellness program. From that are, for example, the registered dietitians. We have cooking demonstrations if our patients want to participate, exercise classes, on and on and on goes for the Journey to Wellness. So with HealthPass Primary, the copay amount is $10 for our patients. $10. Normally, if they came through Faith Family Medical Center, it would be on this, the copay would be on a sliding scale between $25 and $65. But people who participate in HealthPass, they have a $10 copay for the HealthPass Primary. Are there any questions about HealthPass Primary? Sounds like being none, I shall proceed to the next product, and that is HealthPass Portable. HealthPass Portable is $20 per participating employee or member per month. We offer HealthPass Portable through New Benefits. That is our business partner. They are nationwide. They've been in this business of offering health benefits for more than 20 years. Some of the items that are available or benefits that are available through HealthPass Portable are nationwide access to discounted dental and vision care. And that's, again, nationwide. So your employees would be able to either go online, or if they want to talk to a live body, they can, and they can find out who participates near their work or near where they live, wherever they would like, and what types of discounts they can receive. So I'm going to just tell you a little bit more about the dental discount. So these are available through Aetna Dental Network. There are over 262,000 available dental practices nationwide. In most instances, members offer or save 15 to 50% per visit, and specialty care, dental care such as orthodontics and periodontics are included, which is awesome. There's also discounted vision through HealthPass Portable, and there are 20,000 vision providers nationwide through this discounted vision product. The HealthPass Portable members save 10 to 60% on glasses, contacts, laser surgery, and exams. Some examples of participating chains in our discounted vision are Lens Crafters, Pearl Vision, VisionWorks, JCPenney, Target, and more. So this is provided through Coast to Coast Vision. The very of great interest are discounted dental and vision. And as employers, I'm sure you would realize that. Through Teladoc, which is the 24/7 access to board certified physicians by phone or by electronic device, the patients or members who become patients can talk to the doctors. They are all, as I said, board certified. There's a $15 visit fee, and this is for general medical issues. So they offer diagnosis, treatment options, prescription, if medically necessary for the prescription. So what type of ailments can they take care of? Well, common medical issues such as colds, the flu, poison ivy, respiratory infections, bronchitis, pink eye, sinus problems, allergies, urinary tract infections, and ear infections are some examples. Now, it's important for you to know that not only Teladoc, but all of these offerings through HealthPass Portable include that these are available to spouses, domestic partners, and dependents, from children to seniors of the employee or member who participates in HealthPass Portable at no additional cost. So that's very, very, very enticing to many employers and employees, as you can imagine. And then not finally, but two other discounts on hearing aids and durable medical equipment. But the finally, this is something we've recently added, and that is professional counseling and work-life support to help your employees cope with the ups and downs of life through the telephonic employee assistance program. So that's 24/7, 365. Unlimited access, confidential, of course. It's short-term telephonic counseling. And that way your employees can maintain their focus at work. So we're very proud of the offerings of HealthPass Portable. The third product is HealthPass Premium. And that is available for $50 per participating employee or member per month. $50 per participating employee per month. So that includes all that we discussed in HealthPass Primary, and then most of what is included in the Portable. The only difference is that instead of the telephonic employee assistance program, we've gone a step further and offered counseling services as a part of HealthPass Premium. So participating employees can call 24/7 for an assessment, and then they can schedule up to 6 free sessions, free counseling sessions by phone, virtually, or in person, or a combination of those three. So we're very pleased to offer this, making even more robust what we have at Faith Family through our behavioral health nurse practitioner, but also making this counseling available, these counseling. So there you have laid out in front of you the three options: primary, portable, premium. Any questions on this? Okay. So,
I have a
flexible.
question.
Yes, Kimberly.
Hi.
Hi.
My question is this. I noticed that you have dental and vision in HealthPass Portable, but I didn't notice it as part of the primary or the premium.
It is, okay, should
Oh, I
be.
see. There it is.
Oh,
Dental
good.
and vision on the premium, but what about primary?
No, because primary is offered through Faith Family Medical Center. Right now, we don't offer vision and dental services. One day, we hope to, but we don't offer those services at Faith Family Medical Center. And Kimberly, when we first started HealthPass, all we had was primary, but we had many employers asking for discounted dental, vision, etc. And
Okay.
that's why we added portable. So for
Okay.
some, you guys, makes sense?
So you would have to have HealthPass primary plus HealthPass portable in order to have the dental and vision.
Well, you could do just portable,
Right. Okay.
right? You wouldn't have the primary of coming into Faith Family and all the services. But if you wanted to start with just portable, you could.
Okay.
Well,
Okay. And I maybe missed the very beginning. I'm sorry about that. For
all
some
right.
reason, I was on a different link. All these plans are, the portable is nationwide and the rest are by Faith Family Medical here in Tennessee, correct? Middle Tennessee.
That's exactly right. Yes, I'm so glad. And anybody else ask clarifying questions. You know how you've done something for so long, you leave things out. So I'm glad you're asking this.
Okay,
So
thank
that
you.
is right. Portable is nationwide. Primary is locally at Faith Family Medical Center. That's
Thank you.
exactly correct.
And they're all Christian doctors? Can I make that assumption or no?
Well, okay, for primary, yes. Doctors, nurse practitioners, physician assistants,
Okay,
yes.
thank you.
But I'm often told that I tell too much, but I would rather fill in the blank rather than someone thinking and not asking the question. Occasionally I get the question when I conduct tours, and by the way, love to give you a tour if you would
Okay,
like to come to Faith Family.
good.
And I often get the questions by, normally people who are not Christians. Oh, well, number one, do I have to be Christian to be here? If I'm not Christian, are you all going to treat me like a sinner if I do things, that Christians are against Christian tenets? And are you going to try to evangelize me or people if we, they, whomever are not Christians? So the
Mhm.
answer to that is we do not evangelize. We believe that the best sermon is to be a sermon and to be loving and kind. So we do not evangelize. And we see people of all faiths, no faith, any faith. But we are a Christian organization. People who work here, yes, we're Christians. But
Beautiful,
again, go ahead.
beautiful. I'm happy with that. Thank you.
You're welcome. You're so welcome. I'm glad you asked. Again, I tell too much, but I am an under promiser and over deliverer. That will be on my tombstone. And I would rather tell you all up front anything you want to know. And if I don't know the answer, I'll find out the answer. And I often do that for companies and nonprofits who want to learn more to see if it's a fit for your company or for one of your employees or some of your employees. That's what I'm here for, is that personalized touch. Thank you for asking a question. Right now, does anyone else have a question? All right,
May
let's
I
see.
ask one more? I'm sorry, I
You
don't
can
mean.
ask 20 more. Please
Okay.
do.
Medicare. So I'm not on Medicare yet, but at the point in time that some of my employees get there or I'm there,
Yep.
how does that factor in?
So we do not accept patients who have, let me back up. For HealthPass primary at Faith Family Medical Center, we don't accept patients who have Medicare, Medicaid, or TRICARE. TRICARE is for veterans.
Uh-huh.
That is a really excellent, my husband just reached Medicare age, and that's an excellent insurance. I mean, really, people who have it should use it because it is so robust and so good. So, to answer your question, for HealthPass primary, we don't accept Medicare, Medicaid, or TRICARE patients. However, some of our partners still offer HealthPass portable to their employees who have Medicare or Medicaid, or even insurance somewhere else. But it's just maybe the insurance is on the exchange and it's not very robust. It doesn't offer some of these things. So they will offer their employees just portable if the employees want it. So
Okay,
that's good. What else? What other questions?
that's it. That's great. Thank you.
Well, keep them coming. I love that. That's how we find out and know. We are flexible. I just in the past week we've signed up 3 new companies. I was in Ashland City yesterday, and they decided to offer the choice of all 3 of the products, and they're going to have their employees pay a portion of the monthly fee. So I have a few companies, not very many companies that do that, but a few. So they'll collect the employee's portion of the fee, and they'll pay the invoice, once they collect it and they put their portion in. So employees, you design it the way you want it. So yes, you can have your employees pay a portion if you want to. Some companies only offer one product, and that's fine. We're not dictating what you have to offer. And some companies are tiering it. For example, I have a daycare that if you serve 20 hours or less, then you can sign up for HealthPass Portable. But if you work more than 20 hours, then you have the option of signing up for any of the 3 products. And that's obviously based on hours. Other places, like I have a restaurant, of course, high turnover often in restaurants, but this pizza place has employees who've been there 6 years, and they've never had any sort of health benefits. And so for those 6-year employees, they offer them HealthPass. And that's fine. It's what they want to do. You know what? I cannot believe I've not said this one time. And I'm supposed to say it like 50 times, so you've been spared. But HealthPass is not health insurance. Our attorneys make sure we say that. You probably gleaned that, but it is not health insurance. So I'm going to wrap this up by sharing back to where I was. Ann, this is so affordable. Now, Ann, this is too good to be true. How can you do this? How can Faith Family do this? Well, as I just said, we are a nonprofit. I encourage you to go to our website, Faith Family Medical Center's website. Check us out further. It cost us $242 on average to see a patient every time he or she comes through our doors. But I just told you, our sliding scale is $25 to $65 normally. You sign up your employees, their copay's $10. And how do we make up the rest? Generous donors, grants, some government through the safety net payments. So we make up that vast difference by raising over $3 million a year to cover the difference. So that is how we can offer this at such an amazing price. And not only did we do this to help you all, the small business owners, but it allows us to see more patients. It's a creative way for us to get more patients through our doors. Last year, we served about 3,000 patients. We had close to 11,000 patient encounters, but we've moved into a new building during 2020, and we made it large enough that we can double the number of patients that we see. So this is one way that we can get more patients in and help positively change their lives and positively improve small business owners' lives in many ways. So what do we do next? Let's see. If you are interested in more, please reach out. You'll get me at that phone number or that email so that we can talk further. Much to others' chagrin, I am not a hardcore salesperson at all. It's my job in life, I feel, to improve other people's lives. That's why I've had this opportunity to serve at Faith Family, to continue the service to others. So just know that I'm here to answer your questions, any that you may have. So contact me as you have questions. And then you may have, well, okay, and what if we do sign up? What's the next step? A very easy process to offer these products to your employees. They sign up, they get material. If they get the HealthPass Premium or Portable, they get a packet, and including a membership card and a packet with information. They get emails sharing how they can access their benefits. I'm always available to talk with my business partners or nonprofit partners and the members or even potential members. So it's very personal relationship with the people that we serve. So I do encourage you, if you'd like to know more, I'd love to share more. You can see a wonderful testimonial from Dale Harper. He was one of our first adopters at Compost Nashville. And I know with SCORE, and I love SCORE, woohoo for SCORE, and I do keep saying nonprofits. And I'm doing that on purpose because you all might serve on nonprofit boards or have interactions with nonprofits too. So not only do I want you to consider HealthPass for you and your business, but I also hereby ask you to be ambassadors for Faith Family Medical Center so we can serve more people. And we serve people who make Nashville run and tick, you know? So get the word out about that and HealthPass too. Are there any questions? Yes, Kimberly.
Oh, boy. Okay, so I'm on the board of the Notre Dame Club of Nashville. So
Oh,
could our club potentially have this as an offer to all of our members? Or how does that work? Would it be just the board members or would it be all members?
so in that scenario, number one, you can let them know about Faith Family Medical Center in general, that we're available and they can learn more. Okay. If somehow Notre Dame, your club would have to collect or pay for, if they choose to, pay the fee to cover portable, primary, whatever, whichever one, and then pay us in aggregate one time per month. So yes, you offer it to whomever you'd like. Just know that they cannot pay us individually. You would just need to be able to either Notre Dame of Nashville pay for all the members who want to participate, or
Right.
collect um, the monthly fees. Does that make sense?
Yes. Where's the nearest, you said that you could do tours. Where's the nearest location?
Well, there's one location, and it is at the court. We are at the corner of Murphy and 21st. So if anybody knows where the Starbucks is on Charlotte, near Centennial Hospital and St. Thomas Midtown Hospital, we're in that vicinity. Not too far from Elliston Place Soda Shop. Good place.
This is in Nashville or?
Nashville.
Okay,
Yeah, Nashville.
okay. Do you have the address? Because I don't see it. Maybe you
Yes,
already showed it.
I did. No, I didn't put it anywhere, did I? 326 21st Avenue North in Nashville. 326 21st Avenue North.
Hours of operation?
On Monday, let's see, Monday, Tuesday, every day we open at 7:30. On Monday, Tuesdays, and Thursdays we close at 5, and on Wednesdays and Fridays we close at 4. Did you get that?
Yes.
So basically, you got here at 7:30, great. And if you got here no later than 4, great. But I'll give you a tour anytime.
Okay, very good.
Yeah, I'm out salary. I'll come on the weekend. I'll do it in the evening. Anytime you'd like a tour, I'll give you a tour.
Super. I'll call you.
Okay. What else? Michelle, and so remember I told you that sometimes fill in the blanks for what might have been up here but not come out here. Were there
I
any
think,
questions, Michelle, that
no,
you
hang on,
had?
we've got a Q&A. Let's see what we
Oh,
have.
good.
What do participants in HealthPass usually do when they need to go to the emergency room?
Well, certainly if it's life-threatening, they have to go to the emergency room. We don't cover currently. There's no hospital coverage, so they would go to the emergency room. We, of course, for non-emergent, I mean, of course, that's why Teledoc is so helpful, is to help triage for non-emergent. Certainly, if you're having chest pain, I mean, all the things that we know you should go immediately to the ER, go there. But that's why the Teledoc is so helpful, to just help someone determine if they should go to the ER or not, and not have to use a walk-in clinic, because even walk-in clinics are expensive. But to answer your question, right now, they would go to the emergency room if there's that, life-threatening issue.
They may want to look at catastrophic coverage, which
Absolutely.
isn't very expensive, and that could fill in that gap, possibly.
Absolutely. If I didn't have insurance, I would come to Faith Family for my primary care, but because I was raised that way, I would get a catastrophic to cover hospitalization. Yes.
Excellent. Well, Anne, I think you did an excellent job. I think this is just an incredible opportunity for people that do not have insurance. And I know that there's a large segment of people that just can't afford it. So this is just wonderful. And we need to, like you said, spread the word. And thank you so much for being here. And we'll make sure that we've got you on the schedule again to be able
Thank
to
you.
share it with more people.
Thank you, Michelle.
So
Thank you to you, to Lisa, Odell, and to SCORE. I appreciate this opportunity, and I appreciate so much what SCORE does and has for decades. So appreciate you all. Thank you.
thank you, Anne. For the attendees, please go to our website, score.org/Nashville. We have, and click on Take a Workshop. I've just uploaded our schedule, completed it for October as well as November. And I'll have December up there in the next couple of days. So you can start signing up for the rest of the year if you choose to. But you'll be getting emails if you're not getting them already. We appreciate you being here. I hope you found value and hope to see you in the future. Take care, and thanks again.
Thank you all. Bye-bye.
Thank you. Bye.
Bye.